It's Time Warner Cable's local edition. I'm Brad Pomerance. I'm glad you're with us today. We are joined by Holly Mitchell, my Assemblywoman, actually, California State Assembly. We thank you for joining us.
As always, it's a pleasure to be here.
And I want to speak with you about health care and the Affordable Care Act. As you're out on the stump, is there a lot of contention about it? It seems since the Supreme Court upheld the act, the vitriol's died down. Am I wrong?
Well, my experience, I believe, is unique in that I represent the greatest assembly district in the state.
Where I live.
Californians really understand that this is an incredible opportunity for us to get federal dollars to the tune of $9 billion to support our millions of uninsured, particularly right here in LA County. And so here in California, outside of the legislature,
Sure.
when I talk to voters and my constituents, they're two thumbs up about it.
And let's talk about the federal dollars you're talking about, because what was interesting about the U.S. Supreme Court ruling is they upheld the mandate,
Yes.
but they said that the federal government could not force certain Medicare requirements
Right.
on states. And so some states are opting out. Florida, Texas, California is not. California will take those federal dollars.
Yes.
I understand for the first few years, 100% of these programs will be covered by the feds.
100% in many instances, 90% in others. So it gives us a great opportunity to provide care to the millions of uninsured Californians, the underinsured, and make sure that they have access to critical health care services. It's my belief that our general fund and our economy will recover in the next budget cycle or two, so we'll be in a better position when those federal dollars begin to diminish.
What's also interesting about California is even under a Republican governor, Arnold Schwarzenegger, steps were being taken to implement the Affordable Care Act. I mean, Schwarzenegger he signed on. You got to say that.
Absolutely.
And so we're pretty far along in terms of implementation when the switch is turned on. I guess it's 2014?
2014, and we are. California was the first state to introduce legislation by Speaker John Perez and signed by the Schwarzenegger administration
Right.
To create the board,
Right.
The oversight board that really will govern the new
Exchanges.
the exchange that will govern the new kind of federally funded,
Right.
state-funded plans. And so California is light years ahead of most of our states.
That being said, small businesses are nervous. We know that. Are you explaining to small businesses their obligations and lack of obligations? Because in some instances, they are not obligated to provide health care. Their employees can go to an exchange. For larger businesses, it's another story. But
I have a small business council, a community cabinet, and have spoken to some of the small business owners in the 47th district individually who wanted to be in a position to provide their employees health insurance. And so they're looking at it as an opportunity. Is it a struggle? Is it yet another financial responsibility on business today? It is, but most of the business owners I've talked to look to it as an opportunity.
I also want to speak with you about women's rights and family planning. I'm surprised that this is a discussion in 2012, but it's been injected into the vernacular as a result of Missouri Senate candidate Todd Akin. We can put that aside, but simultaneously, you had a bill pushing through the legislature on family planning.
I did. I was pleased to author AB 2348, sponsored by Planned Parenthood and a number of other women's health advocacy organizations. The focus of our bill was to expand access to birth control services. Because we have a health care provider shortage in California, women are waiting for access to exams and access to hormonal contraceptives. Our bill will make it easier to access hormonal contraceptives.
And what's been the response been? I mean, Planned Parenthood, it's a charged organization at this stage.
It is, but again, there were a number of other organizations, the nurse practitioners, the American College of Obstetricians and Gynecologists, everybody weighed in. Lots of discussion about the efficacy of the bill, but in the final analysis, everybody determined it was best for women.
Her name is Holly Mitchell, member of the California State Assembly. I'm Brad Pomerance. We thank you for watching Time Warner Cable's local edition.